When we talk about hormones, if you're a woman, you most probably think about estrogen. Men think about testosterone. Actually, we have so many different types of hormones. One of the groups, for instance, are the steroid hormones, and your steroid hormones come from cholesterol. And they include testosterone, estrogen, your thyroid hormone, cortisol, adrenaline. Most of your adrenal hormones are steroid hormones. Our sex hormones, testosterone, estrogen, and progesterone, are all steroid hormones. And what I think most of us do not know is that both men and women have testosterone as well as estrogen, and they play an incredibly important role in things like brain function, your gut health, anxiety, depression. Our sexual functioning depends on both testosterone and estrogen in men and women. At the T Clinic, one of the things that we do is create balance in these systems. As we get older, the hormone levels start decreasing, and not necessarily in a good ratio to one another. And this causes the imbalance. Decrease in some of your sex hormones or imbalances there lead to a decline in cognitive function and behavior, decreased sexual functioning, and that doesn't necessarily mean erectile functioning. It means a decrease in your libido, in sex drive. It can lead to a lack of lubrication in women or erectile difficulties in men. Mental conditions and mental behavior is directly affected due to your sex hormones. Energy, weight, and general well-being declines as hormone levels go out of sync. Age is a state of mind, but as our hormone levels start decreasing and go out of sync, the physical manifestations start playing a role. Here at the T Clinic, that's exactly what we do. We rebalance systems and optimize them, bringing back quality of life and well-being.